Hello and welcome back. This is the fourth section of session number 1. And in the last section, we took a run through some ideas surrounding the differentiation of naturopathic thought from conventional medical thought. And we're going to continue on that vein a little bit in this coming section as well, as we start to look at what is evidence-based medicine and what are ways that we can know that something is a good therapeutic to use with a patient. And this is a really large topic, which we're just going to stick our toe in to today. But obviously, if you are aware of the types of debates that go on within the government in terms of what types of therapeutics or what types of medicine get funding through public health care, or in an insurance-based system, what types of therapeutics get rebates under insurance, then you're aware of the fact that there is a big push in most Western countries towards the idea of practicing only evidence-based medicine and using that argument as a way to, I won't say invalidate other systems of medicine, but to give priority to systems of medicine that have been demonstrated through hard scientific studies, randomized control trials for the most part, which are the double-blind, placebo-controlled type study, to be shown to be effective. And so I want to just introduce you to some of the ideas around evidence-based medicine, and so that we can understand what it is and what it isn't, and perhaps develop our own ideas about what it is that evidence-based medicine should be, what should be emphasized about that in practice. So starting off with just a definition, this is from an article back in 1996, back when this idea was sort of in its infancy, I suppose, at least in a formal sense. And the definition here of evidence-based medicine is: the practice of evidence-based medicine means integrating individual clinical expertise with the best available external clinical evidence from systematic research. By individual clinical expertise, we mean the proficiency and judgment that individual clinicians acquire through clinical experience and clinical practice. So this is a very balanced definition of evidence-based medicine, and perhaps was one of the earliest ones that was written down. And it's one that I find very satisfying in terms of its balanced consideration of the expertise of an individual clinician, whether that's a conventional medical doctor or a naturopath or an acupuncturist or any type of clinical practitioner, and also taking into account, obviously, the best available external clinical evidence from systematic research. So the interesting thing about the cultural focus at present on evidence-based medicine is that it seems as though that term, evidence-based medicine, has now come to mean, in many people's minds, only using therapeutics that are backed by a study such as a randomized controlled trial, and excluding other therapeutics from consideration if they don't have that type of research backing. And I think that I and most naturopaths most likely would put forward the idea that individual practitioner experience, which could be either one's own experience as a clinician, or early on taking on the teaching of your teachers and their clinical experience, has really significant value even in an evidence-based medicine paradigm. And that's why this definition of evidence-based medicine is really nice. And if that weren't true, then all of medicine, whether it would be naturopathic medicine or conventional Western medicine, would really be completely paralyzed, because there's a great deal of either conventional medicine or naturopathic medicine or acupuncture or any clinical practice that actually is not backed by randomized controlled trial or other types of systematic research. And so if we were only to use therapeutics based upon what the research has shown us through this type of study, then we would be quite paralyzed, because there's really so much that we do that doesn't have that type of research behind it. And it would be a whole, political discussion to talk about why that research is or isn't available, so we won't go into that at this stage. Here's another definition just from a little bit later, 1999. Genuine evidence-based practice actually presupposes an interpretive paradigm in which the patient experiences illness in a unique and contextual way. So this is talking about individualized medicine as opposed to treating everyone the same. Furthermore, it is only within such an interpretive paradigm that a clinician can meaningfully draw on all aspects of evidence, his or her own case-based experience, the patient's individual and cultural perspectives, and the results of rigorous clinical research trials and observational studies to reach an integrated clinical judgment. So I've added the emphasis in that quote, the non-italicized part. And so the idea of holistic medicine, and going back to this idea of whole medical systems, is being able to take the individual sitting in front of you and looking at them in a holistic manner, which needs to take into account all of who they are. And they are going to have a very specific narrative about their illness that might be different than somebody else who has that same illness. And being able to take, for a clinician, being able to take into account all the experience that you've had with different types of individuals who have that illness, that is a type of evidence that comes from another place than rigorous clinical research trials, which is a different type of evidence. So again, in this definition, we're looking at creating a balance in our evidence-based practice between considering the rigorous clinical research studies and considering the experience that we have as a clinician, or the experience that we've learned about from our teachers. This is another quote from that same article. The truths established by the empirical observation of populations in randomized trials and cohort studies cannot be mechanistically applied to individual patients whose behavior is irremediably contextual and idiosyncratic, or episodes of illness. So this idea goes forward again with talking about when you are treating somebody from a holistic perspective, as we do in naturopathy, we can't remove the individual and their individual experience of their illness from the picture of how we consider what types of therapeutics that we're going to use with them. We can look at the empirical studies, the randomized trials, and we can see what that tells us about what might be good therapeutics for this patient. But we might come to the conclusion that some of those therapeutics might or might not be a good idea because of the way this particular individual is showing up in their illness. So again, maintaining that balance between taking the study results or randomized trial results and that type of hard evidence as applied to populations versus the experience that we have with the particular individual sitting in front of us. And it's worth noting that, even in a randomized trial, when you say you're doing a randomized trial on a herb and you find that 75% of the population had beneficial effects from that herb, and so that herb is then considered useful for that condition, and that's a positive study for that herb, but you still have 25% of the people who didn't respond positively to that herb. The same thing happens in drug trials as well. There are many drugs on the market that have something like a 50% effectiveness rate with the population, and so just because that drug has been found to be useful and is on the market for treating of a certain condition, there are always individualized reasons why a person may or may not respond to a drug, and that's the reason why it's important to take into account the particular situation of the patient sitting before you and not just consider the randomized studies. I love these quotes from Albert Einstein. He's one of my favorite people to mine quotes from. Not everything that counts can be counted, and not everything that can be counted counts. And this is just a reminder that a randomized controlled trial is not the end-all and be-all of evidence to consider, and we have to consider the qualitative aspects of our patients as well. I like the second quote as well. Whosoever undertakes to set himself up as a judge of truth and knowledge is shipwrecked by the laughter of the gods. So the term evidence-informed practice is perhaps a more accurate description of these principles in action, and this is really what we do. This is just a reframing of the language of evidence-based medicine to provide a better languaging of those balanced definitions that we were just looking at, so that we don't fall into the trap of believing that scientific studies, randomized controlled trials, are the only valid evidence, because they aren't. And so evidence-informed practice is one of my preferred terms, so that we keep in mind what it is that we're doing and we don't fall into the definition that's being used more in the mainstream at this stage. We'll talk now about ways of knowing. So we've just been talking about the fact that we can know something might be a useful therapeutic because it has a positive randomized trial behind it. But we also can know in other ways. And so I'd like to explore the different ways that we can know something and we're talking about this in terms of knowing what a good potential therapeutic for a patient would be. This quote from a book called A Question of Knowledge by Richenda Power. There is knowledge other than the scientific. We need a new form of science and medicine. And her reference here relates to the fact that science is being applied in a very, very narrow way to medicine on the whole, and the types of scientific evidence that are considered valid in medicine. For the rest of the quote, instinctive common sense and experience are good enough, and medicine is not scientific anyway. So this is a very interesting end of this quote. Medicine is not scientific anyway. What does she mean by that? So we're starting to explore the different types of evidence that we have available to us as practitioners. And by medicine is not scientific, she's likely pointing to the fact that the human organism, the human being, is very individualized, and each of us is unique. And so when we talk about science, the scientific method, we're talking about testing hypotheses in a way that they can be tested again later and get the same results. So you have repeatable results, so that you can decide that something is true because it reliably creates the same results on multiple occasions. And that is the logic behind the scientific method, whether it's medical research or other types of research. But given the fact that humans are quite individualized and we all have different strengths and weaknesses in our biochemistry and our different aspects of our being, our psychology, our mental factors, those sorts of things, we may have some capacity to predict how a human is going to become ill or to heal or to respond to any given treatment. But it's not predictable enough in general to meet the standards of the scientific method. And so, doctors are often very confounded by the fact that they will use certain medicines with certain people and they won't get the response that they're looking for. Nowhere is this more obvious than in cancer treatment, where you can use a certain chemotherapy with a certain cancer in a certain person and it eradicates the cancer, and in another patient it has no effect at all. And so we are individualized beings, and I think that this is what she means by medicine is not scientific. Science really deals with a reductionist generalization to a population, and medicine is really dealing with whole individuals, and our bodies and minds and spirits are not always predictable in how they respond to things. So how can we know something? And when I talk about we, I'm talking about if I'm sitting and being a naturopathic practitioner, how do I know that something is true from my all the different ways that I can know something? So I can know something by direct experience of my senses. I can know it because I can see it or touch it or hear it, for example. And in a medical setting or a naturopathic setting, we might know that that a person is having pain in their abdomen because we touch their abdomen and they tell us it's painful, or they yell out, or they wince, or they tighten their muscles up. So that's knowing something through your direct senses. There's a lot that we do in our diagnostic work that we know is true because of what we sense with our senses. We also can know something by reasoning or by inference. We can apply what we already know, say from the study of physiology or biochemistry. We can do an analysis of what's going on with the patient in front of us and come to some conclusions through our own capacities for reasoning, and we might then have an idea that we know that that is true about that particular patient. And then we can also know things about through sources of authority, things that we consider to be authority, experts or studies. And I would put also in the category of authority some of our especially more experienced teachers as we go through our study of natural medicine, because a lot of the study of traditional forms of medicine, holistic forms of medicine, is knowledge that's not captured well in any of our textbooks perhaps, but is more of an oral learning experience. So we just want to be sure that we're not excluding valid ways of knowing that things are true. I would say that one thing that's not listed on this slide that's a way that we can perhaps start to explore the truth of something or explore our reliance upon something is that we can test things out on ourselves. If I am having a particular problem and I take a particular herb that I think might be a good thing to address that, and I find that it does help, then that's not obviously a scientific study. That's me. That's an N of 1 for looking at that particular herb. But that might give me a better reason to rely on that herb in the future with different patients, and then I can see how they respond to it, and that gives me more evidence. So over time, working with patients, you accumulate quite a bit of knowledge from your own practice. And I would put that in the category of direct experience with your senses. If you prescribe a herb to a patient and they come back in 2 weeks later and the problem that they were having is gone, that gives you some evidence that that herb was helpful. It's not a scientific study, granted, but if you repeat that enough times with that herb with enough patients, you come to a point where you really do believe and feel that that herb is useful for that particular thing. So then what is science? Because we've talked about ways that we might know things, and we've included ways that are not necessarily hard science. We would define science as the observation, identification, description, experimental investigation, and theoretical explanation of phenomena, and that's a dictionary definition. But when people use the word science, they're often referring to different ideas, and there are a couple of ways of looking at science. We must acknowledge that even with scientific exploration, there's still more in the human organism that we cannot explain in scientific terms than there is stuff that we can explain in scientific terms. So we really know our knowledge is growing all the time, but there's a lot that we haven't been able to explain yet. So we have to have confidence in our training and our continued lifelong learning that we engage in throughout our entire lifetime, whether we're a practitioner or not, that we can extrapolate from what we know to provide wise guidance to our patients. And that's even if science hasn't explained yet all that we're doing, because, perhaps it never will. And I think that probably a lot of what we do these days that's been considered quite marginal in the past is starting to gain greater traction because, for example, the advances in the understanding of quantum mechanics, quantum physics, has started to be able to address a lot of things that relate to the way energy works, for example, in energy medicine. And so we are doing a lot of things that might not be explainable by science right now, but might be in the future. We may do a lot of things now that we find really useful, and we really can't explain why it is that we work, why it is that that works. And I'd say that that's also true for conventional medicine as well. There are quite a number of drugs on the market that are used for certain things that there's no mechanism of action that has been explained as to why that drug works for that particular thing. So natural medicine is not alone in that regard. We're all in the same boat together with regard to that. The next slide, this is one of my favorite definitions of science. This is a very informal definition of science from someone who was my teacher and one of my greatest mentors in studying naturopathy. She is an elder of American naturopathy, Dr. Nancy Welliver, and she defines science as what we know so far about how the world works. And so obviously science, the realm of science is growing over time, and we get to know more all the time, but we must acknowledge that there's a lot that we don't know yet about how the world works. Just a closing quote for this section. Buried deep within each and every one of us, there is an instinctive, heartfelt awareness that provides, if we allow it to, the most reliable guide as to whether or not our actions are really in the long-term interests of our planet and all the life it supports. We need to listen more to the common sense emanating from our hearts. So that's a quote that just supports the idea that making a decision based upon a randomized controlled trial doesn't create the balance of bringing in all the different ways of knowing that something might be the right thing for a patient. So thank you for your attention in this session, and I will see you in the next recording.